It is BBC Radio Devon. So, the next part of the programme, we have a good long chat with some interesting people. That's essentially the way it works, and that's exactly what we're going to do in a few moments' time. And we're also going to hear this morning from Brian Stoyel, who is a Rotarian, and this man is in charge of some 88 clubs. Brian Stoyel. Have I pronounced that right, Brian? Now, Brian is a Rotarian. In fact, you could say he is the Rotarian. He's about to become the new District Governor for the SouthWest, and he's in charge of no fewer than 88 clubs. He lives near Plymouth, but he's just got back from Africa, where he's been working on projects to fight malaria. Now, Rotary is, of course, a formidable force when it comes to fundraising, so hopefully we'll get an insight into fundraising from him. Brian, welcome. Thank you so much for coming in this morning.
Thank you very much.
Good to see you. Okay, let's have a potted history of Rotary then. When did it start? I notice you've got a shirt. In fact, it's a denim shirt with a Rotary badge on. That's a great combination. When did it start?
It started in 1905 in America, and the founder was a solicitor by the name of Paul Harris, who really wanted to get together with some friends, and the modern terminology probably was networking. Wanted to network with a few of his friends, and they went around, and that's how it really became Rotary. And that was really the start of it. And eventually they gathered a few more people together, and then it spread across the world to Ireland, to England, and the rest of the world. So it is now a worldwide organisation of some 1.2 million members. And I suppose the best way to look at it really is made up of like-minded people wanting to help in their communities, both at home and abroad. So it's had a very checkered career over its time, and doing a great deal of work. Probably the most notable at present is the End Polio Now, which is bringing polio eradication to the fore, and hopefully within the next few years we will actually get rid of it completely.
That's
going to be a great thing.
That is a huge
aspiration,
and is that achievable in your view?
It is achievable, I think, yes. It's been going now for 25 years. We've been fighting it, but this current time now, there's only a few cases being reported in Afghanistan and Pakistan, again because of political unrest in those countries. It's very difficult to get to the people. But Nigeria has now been cleared for about, I think it's about 3 or 4 months. So that's a good step. India went clear about 2 years ago. So we're just looking at 2 countries. But as I say, that is going to be the real hard nut to crack.
Yeah.
It's possible.
And you mentioned the membership in terms of a million plus members. Do we know how, and this figure may not be available, which is understandable, of course, but do we know about how much money is raised, either at a local level or an international level or national?
I suppose the easiest way to put that currently is to say with the Nepal disaster just a few weeks ago, about £20,000 has been sent to Nepal just in the last few days to help them.
Wow.
And I've been told that £20,000 here can be 10 times, 20 times that actually in the country. So we've probably raised $250,000 for Nepal to help them over this dire need. But throughout the world, I've got no idea really. It's just millions and probably billions and billions of pounds over the years.
Would make sense, wouldn't it?
Yes.
And do you feel that what you do as a Rotarian can make a real difference?
It can, because we're dealing with all types of calamities. Just hearing Irina just now is very interesting, because one of our areas of focus is peace, promoting peace throughout the world, preventing diseases, clean water, sanitation, health, basic education. So we can help in so many spheres that, yes, it is very, very worthwhile. And it means that Rotarians can actually roll up their sleeves and do something. It's not only about fundraising, which I think is very, very important. If we get tired of shaking that can, or people get tired of seeing us shaking that can, perhaps. So really can roll up our sleeves and help the old lady who loves her garden, but can't manage to dig it any longer. Perhaps we can help in those sort of cases locally.
It's an interesting notion, isn't it, in terms of giving your time and/or, as well as perhaps alongside giving money, and that's quite an important step, isn't it?
It is. Time, money, and of course there's something else as well, and that's vocation, which a lot of people can bring their own vocations into Rotary as well. Carers or people like that, teachers, health people, they can all bring that into Rotary. So it's not just a standalone organisation, it is a combining organisation of so many different facets.
And I mentioned you are, I'm not quite sure if it's the exact title, but the District Governor for the Southwest.
That's
I feel
right.
as if I should stand up.
Well, no, please sit down.
It says here, looking after some 88 clubs.
That's right. Well, up
And a
until
kind of an overall...
the 1st of July this year, 2015, we are 2 districts.
Ah.
That is Cornwall and a little bit of Plymouth and Devon, and the rest of it is all Devon. But from the 1st of July, we are going to be one complete district.
Right.
So we stretch from Axminster right down to the Isles of Scilly, from Bideford Barnstable right down to Torbay. So that's where the 88 clubs come from.
That's interesting, because I was going to ask you what version of the Southwest we were referring to, because some of the government ones are basically, it's much further east than most people in the Southwest think is really Southwest. Like Gloucestershire? Right. That's not the Southwest. And like when the Southwest are in Bath, you're like, no, you're
it's not quite, is it?
And so that is Southwest proper, really, isn't it?
Yes, it is.
That's a huge number of clubs, isn't it?
It is a large number, yes.
In a good way.
Yes, I think they can do a lot more projects together. And this is the secret of it, really, working together. And, for instance, the governor has to visit all the clubs, or should do. And I'm hoping to combine visits, like we'll say to Bideford and Bideford Bridge, which are 2 clubs there. If I can visit those on the same occasion, then it brings them working together and makes I think it gives us more help as well, because some clubs are big, some clubs are small, but if they can combine, then it makes life a lot easier.
And share skills as well,
exactly.
I would
yes.
have thought.
True.
Is it possible to say, and again it might not be as easily defined as that, in terms of the balance between raising money and doing work locally and or doing bigger projects? So you've come back from Africa, you've been talking about the aspiration to eradicate polio. About how much time and effort of a local club may end up being realised locally?
It probably fundraising is the bigger aspect of it, 60%, 65% perhaps. It's not that we're not able to do the work, it's finding the work, because nowadays there's so many restrictions placed on us, we cannot go out and just do the work. We've got to get permission to go into people's homes and things like that.
Digging the garden example.
That's right, digging the garden or fitting fire alarms or something of that nature.
Yeah.
It's not as easy as it used to be. But if people contact us, then we can always try to help. And in a minute I'll give you some websites and telephone numbers which listeners can phone in on.
Absolutely. So when does your tour of the Southwest start?
It starts on
Brian
the 3rd
on
of July.
You have a T-shirt.
Brian on
You should get one with the different names of the clubs. You could sort of tick them off as you
Yes,
go.
I will do. Yes, I'm a bit known for those sort of things, so perhaps I'll take that on board.
Perhaps you could.
All right.
I was going to be mean and say, okay, name them. But then I thought that...
No, I'm not going to name all. I've got them written down here.
Yeah.
Now, I start on the 3rd of July by Axminster.
Yes.
And I thought then...
That's great, because that's an A.
That's
and it's
an
also
A.
in the far east of your
And then
patch.
I travelled to the Isles of Scilly on the Saturday to visit that club on the Monday evening.
Yes.
So the 2 extremes to start off with.
Yes, the ends, the far ends. I'm guessing you're retired. I'm not.
No, I run an education.
But so you're managing to do this as well.
Yes, well, with my wife, and she does most of that work.
What?
Is that on air now, is it?
Of course. Okay, so you are really. That is dedication, isn't it? Because you're having to do this alongside a kind of a day job, as it were.
That's right, but Rotary's been an opportunity. I think most of us going through life want to do something, and but who do you contact? And I was given that opportunity to join Rotary many years ago, and it's been a life's lifeline, really, if you like, to all the family. All the family are involved with it, and it's been great fun. We met tremendous people all over the world, and we still keep in touch.
Wonderful. Tell you what, Brian, that's very interesting indeed, and we shall have a short break for some music and some travel information as well, always important on a Saturday. And we shall find out, as we mentioned, that you'd recently been to Africa doing some work there regarding malaria. So we'll find out exactly what Brian's been doing and what difference it's made. And also, as he says, just make sure we pass on those details in terms of if you want to get in touch, you're listening to this and you're thinking, wow, Rotary, that could be for me, then Brian will pop back in a few moments to bring us up to date with how you can do that. So this is BBC Radio, and he's going to tell us much more about his experiences working with Rotary in Africa in efforts to combat malaria. So back on here, BBC Radio Devon, in just a few moments. Brian Stoyel is a Rotarian. He is the District Governor for the SouthWest, so that means he kind of oversees 88 clubs across Devon and Cornwall. Also, Brian has just come back from Africa, or recently returned from Africa, working on projects to fight malaria. Brian, where had you been?
I've just come back from Tanzania, but if I can go back a little bit further about that, as I said earlier, Rotary is an opportunity, and I'd always wanted to do some work abroad. And along with some Rotaractors who are 18 to 30-year-olds, I took a team over to, we were going to go to the Gambia, but civil war broke out there, so we didn't go there. We went into Eastern Europe. And then coming back again, we did several other tours to different places. And I was elected as president of Rotary in Great Britain and Ireland. And then I wanted an international project, and I thought, what better way than having malaria? Because unfortunately, if you can imagine 7 jumbo jets crashing every day, that's the number of people that die through malaria every day in sub-Saharan Africa. So it is quite a devastating...
Still,
that's right. And just while I've been on the programme, a child dies every 30 seconds. So we've lost about 120 at the end of the hour programme.
Extraordinary.
So I was out in Tanzania checking up, and I formed REMIT, which is Rotarians Eliminating Malaria in Tanzania. And I thought it would last for a couple of years, but thankfully that was, 15 years ago now, nearly 15 years ago. So that was great. And I went out to Tanzania to check on the projects that we've been doing. We've raised about £250,000 so far to supply bed nets, supply mosquito repellent trees, to spray houses, interior of houses with insecticide, and various things like that. But of course the long-lasting nets is the big thing, that if we can get them to sleep under the long-lasting nets, that does cut down the mortality rate, especially in young children and pregnant women, because they're most vulnerable through their immune systems being quite low.
That's interesting. So I'm surprised the death rates are so high still. And I'm interested in what can be done. These sound like relatively low-tech, and that's not a criticism. No. They're relatively low-tech solutions. Is the answer really nets?
It is, for the time being. We have been waiting for a vaccine or injection for...
Which you might think would be the thing, medication or vaccine. Right. But actually, literally stopping the mosquitoes biting in terms of nets is one of the biggest ways. The way,
because I did a lot of research over here at the Tropical Schools of Medicine and in Africa as well, the Ministry of Health and that, and all they wanted really was nets. Leave the vaccines to the pharmaceutical companies because it costs millions and millions to... And the trouble with the mosquito is it keeps on changing. It's one of those little creatures that it gets used to one thing, we'll change so you've got to invent something else then, and then it'll change again. So very difficult. But they say there is trials going on at present in Uganda and Mozambique and places like that, and it's been quite successful. So perhaps in another 10 years after trials, we may be okay. But then, of course, it's the cost. It'll be all right for us going to Africa on our holidays, but it's not going to be like the polio drops, as I said at the very beginning. Just give 2 small drops and polio is gone. But that's not the same for malaria just yet.
So how difficult, what is the issue regarding, if the solution is a net, what is the block to that being used? Is it availability of nets? Is it partly education?
It's cost.
Cost.
Because you've got to buy the nets.
Yep.
And it's education. I think education is essential with all these things.
And both of those things, presumably, Rotarians can get involved and really help with. I would have thought the fundraising is what we know you for, and it would appear a big project like such as you're doing to try and sort of really curb malaria in Tanzania is something we can really go for.
Why I chose Tanzania for my own specific project was that the nets are actually made in Tanzania in a very high-tech factory, which I visited this time, and the cost is £2.50 each.
Right.
So if you can get a family, because the African way of life is a mother and father, 2 children will sleep under one net. So if you can get that into every household, every hospital, every school, then you're a long way there. Because now they've got the insecticide built into the net fabric as well, so it kills the mosquito as soon as it touches.
And if you're actually raising a lot of money to buy a lot of nets, and if you're buying those nets from that factory, that's actually helping the local economy.
Exactly.
That's fantastic.
That's the way around, yes.
That's a great
And
model.
Of course, with Rotary being for men and women, we've got everybody helping out in Tanzania and this country, helping towards the same goal.
It's extraordinary. It's inspiring stuff. This is Brian Stoyel, who is with the Rotarians. I can call you
Rotary.
who is with Rotary. You are a Rotarian.
Right.
Excellent. How can people get involved if they've heard this and thought this is something I want to do? What's their step?
Go onto our website, www.rotary1175.org, or else contact me on my mobile 077 68 700 466.
Right, read those again.
Rotary 1175.
So Rotary 1175. Okay.
.org.
Yep. .org. Yep.
And 077
077
68
68
700
700
466.
466.
And I can put them in touch then with a club locally to them.
Because it will be, as we say, you're sort of southwest, you're Devon and Cornwall.
That's right.
Really, aren't you?
That's for women and men.
Yes, you keep saying women and men. Did it used to be only men?
It used to be only men,
okay.
That's right, yes.
Yes,
that's
fair enough. I'm just wondering why you're...
Yes, so we're all inclusive now.
Excellent, quite right too. Why rule out half the population either way?
Exactly.
It doesn't make sense.
And it's been great working together.
Of course. Thank you very much. That's Brian Stoyel then. Rotary1175.org. Probably if you search Rotary, you probably come across it. But anyway.